Dear friends, today in this crossfire section, we are discussing the role of newer treatment modalities for BPH. I am Ananda Dhanasekaran. I am a consultant from Birmingham. I am for the support of the role of newer modalities. So my vote is a big yes. Thank you for USICON 22 organizing committee for inviting me for this presentation. BPH surgical treatment is an evolving concept. We all know historically how we have moved from the open prostatectomy age to TURP. I'm sure many of the seniors in this audience will be very proud when they were the first to do TURP in their area with a large learning curve, need to travel a long distance to learn the techniques, etc. At the time, nobody thought that TURP is not necessary. Everybody vouched to learn the TURP because they understood its importance and the place in the clinical practice. From TURP, we are moving towards minimally invasive surgical treatment, fondly called as MIST. At this point, I just want to take you all to our Indian heritage history. You all may know, or at least few of you will know, the Nichiket's questions to the Yamaraja. Like this, my dear friend Dr. Nichiket Vyas is asking few questions whether is there a role for the newer modalities in the benign prostate treatment. I'm going to give the answers and I'm sure he will be convinced in the end. The advantage of the minimally invasive treatment is the choices of variety. We have Urolift, Resume, iTind to start with for smaller prostates. Then we have holmium enucleation, thulium enucleation or bipolar enucleation for the larger prostates, which we call it as anatomic endoscopic enucleation of the prostate. And then we have the big boy player, the robot, which brings in robotic assisted simple prostatectomy. Believe me, there are at least 8 to 9 new further modalities in research. I'm quite proud to share that I'm taking part in at least 3 of the newer instruments which are going to be released at least by 2025. Newer modalities seems to be looking at the better side of the future. They are not necessarily in requirement of anesthesia, at least few modalities like Urolift and iTind. They preserve erection and ejaculation. That's much more important, very good factor for the young patients now facing TURP surgery. Relatively, they are safe with anticoagulants. It is always safe to stop the anticoagulants as needed, but you all know patients on drugs like warfarin and multiple drugs will bleed in spite of stopping for adequate times in TURP. There is no need for overnight stay. This is a big factor in Western countries like America or England, where patients should be discharged as soon as possible and they should recuperate as early as possible so they will be back in the field for the job. It is also makes the patient quite easy to return back to their work. It definitely has less morbidity. I'm not saying about mortality because none of the techniques including TURP has a huge percentage of mortality. Disadvantage of TURP, everybody is aware of. It definitely needs anesthesia. Anticoagulants need to be stopped adequately, and in spite of that, patient can bleed like anything. TUR syndrome and other metabolic abnormalities are well known in patients who are quite challenged with decreased renal reserve or elderly age. Learning curve is quite steep. I remember quite fondly my experience where Dr. SVK literally holded my hands to teach the TURP. I felt sorry for him. There are some specific case scenarios where the newer modalities has much better role. For example, a 40-year-old presenting with high bladder neck, he wishes to preserve his antegrade ejaculation. He may be interested to have few more children. A 60-year-old with spinal deformity which I'm going to present on Saturday 29th at 2:30 p.m. That will be a definite no scenario for TURP. A 80-year-old patient on anticoagulants not fit for GA. A 90-year-old patient with significant electrolyte imbalance who needs some sort of prostate treatment and doesn't want to suffer with a catheter. So there are some very good number of scenarios where the newer modalities has big role. I will touch very briefly on various modalities to give you all a kind of a taster. Urolift can be done under anesthesia, local anesthesia. There are significant evidence like lift study, pulsar study, mid-lift study available. All the guidelines are supporting it, and there are some advanced techniques also available which will be formally released in AUA 2023. Resume works by the principle of convective radiofrequency based steam treatment. Multiple evidences, has few disadvantages like dysuria, patient requires catheter for maybe 4 to 5 days, but has still a role. iTind is one of the very minimalist approach. It's an outpatient procedure suitable for prostates around 40, maximum 60 cc. Since it's very simple, the output also minimal, but that is suitable for many patients in the age of 40 who doesn't want to have the big procedure losing erections and ejaculations. There are some advantages and disadvantages for everything, but they are not as bad as the TURP, which we all know. Aquablation is water jet based. I'm so glad that Mujalibai Patel Hospital Nadia led the initial experiments and released the Water 1 study. It's a very complex procedure involving a robotic arm, etc. But nobody believed that automated system will be available for such a complex surgery for benign prostate, and it's there now. Robotic simple prostatectomy. Again, another big player in our day-to-day practice. Robot is also can be used for simple prostate surgery. It really helps the pelvic surgeons to cut down the learning curve. So those who are doing the radical prostatectomy as a part of their oncology practice, they will benefit by learning, increasing their techniques. It's a typical replica of the open transvesical open prostatectomy. There are some disadvantages like cost, but end of the day, it is doable and we can make these procedures as a day case if there is an appropriate teamwork involved. So in conclusion, there are so many rails to say that newer treatment modalities for BPH has the role to play. As we all know, change is the only thing which remains unchanged. I hope, like the historical Nichiket, our friend Dr. Nichiket Vyas also got all the questions answered. Thank you.